So, when you hear the word intrusive, I want you to think of an intruder.
Hello, and welcome to Therapy Notes 30. I'm your host, Dr. Elaine Malik. This is where practical psychology meets everyday living. This is a site where I talk about concepts, issues, topics that we hear in therapy. This is not meant to treat or diagnose anything, but is for educational purposes only. So come along and listen to some of the everyday things that we talk about in therapy.
Talk about something called intrusive thoughts, especially in postpartum women, but really it can affect everyone, people of different ages and backgrounds. So, when you hear the word intrusive, I want you to think of an intruder, right? So, why are these thoughts called intrusive thoughts? Because they are thoughts that, like an intruder, enter without permission, they are unwanted, and they are automatic, right? And so you can think of it this way. Imagine that you were at a party, or perhaps you threw a party, and you have the guests that you invited, people that you want to be there, and all of a sudden someone comes walking in who was not invited, you don't recognize them, and their appearance is not very pleasant. They probably smell very bad. They look very unkempt and just not well cared for. And they also proceed to harass and fuss at your party guests. You're probably thinking, well, they don't need to be there. So, you want to get them out, right? And so you really have the choice of going over to them, asking them to leave, and then waiting for them to leave. Or you can continue with your party and ignore them. So I want you to hold this analogy in your mind as we dive deeper into what makes intrusive thoughts so uncomfortable and disturbing, but what you can do about them. Okay? So, again, intrusive thoughts tend to be unwanted, and these thoughts often bother us so much because they do not reflect who we are as a person or what we believe in. And so they can be very distressing, right? So I'm going to use a typical example that I've seen with postpartum women. You're walking down the steps with your newborn baby. You know you love this baby and you would do anything to protect them. Certainly, you wouldn't deliberately put them in harm's way. But then, as you're walking down the steps with your baby, you picture yourself actively throwing the baby down the steps. Now, again, this is a kind of thought that would make a new mother feel very bad. And it can create a lot of anxiety, self doubt. And we've seen, even in some situations, it can make the person then become very afraid of themselves and don't trust themselves anymore with their baby, right? So that is an intrusive thought. But how does a thought like that enter someone's mind? So, going back to the analogy of the party, um, that intruder that walked in, again, was uninvited, right? And often the intruder in that situation is very annoying and insists on staying, right, at the party. They don't want to be told to leave, they want to stay, even though they weren't invited. So, picture a situation where you walked up to the intruder, you asked them very kindly to leave, and they refused to leave. You could stand there and keep fighting with them, maybe get security, right, to kick them out. Um, but if for some reason they are still not leaving the party, you then find yourself in a situation where you could get stuck in that spot, arguing with this intruder while your party is carrying on without you. And so you're missing out on all the fun. So you really have a choice. Are you going to continue to argue with this intruder and miss out on your party? Or will you perhaps let them be and go on to enjoy your party, hoping that at some point they'll just fade into the background and maybe go away, or that they themselves at some point, will decide that they are no longer wanted and stop bothering you. That's really the choice that we have with intrusive thoughts. When they come into our mind because they are automatic, we have the choice whether or not to attend to them, right? To focus on them and give them a lot of attention. And this is the part that people often get stuck because the tendency we have is to think about that thought and how we want to get it out of our mind. So we're essentially like the person in the illustration, we're essentially fighting with the thought. And that unfortunately doesn't necessarily work out well. For sure, there are times when we have some thoughts that we can banish by just willing it away or just stop thinking about it. Um, but that is often not the case with intrusive thoughts. They tend to be more persistent in a way that makes us really then have to find a different approach. So, having sort of established how um, intrusive thoughts function, again, we want to keep in mind that these thoughts often do not reflect who we are as a person. We can have intrusive thoughts that are the most bizarre or the most uh, unnatural um, aspects of a person that we cannot relate to, that don't reflect us at all. So the question is, why do we get intrusive thoughts? Well, the brain, being as busy as it is and having so much information that it's working through um, throughout the day, sometimes produces noise. And that's what an intrusive thought can be, a noise that's being produced by your brain. And yet, the tendency for us to get stuck fighting with and struggling with intrusive thoughts is also the brain trying to protect us because that's how it's designed. So basically, if your brain catches that there is a thought that has come up that makes you feel very fearful or distressed, right? As an intrusive thought, it then wants you to pay attention to that thought because it's saying, hey, you're going to want to, you know, kick this guest out of here, right? This is a guest that shouldn't be here. You're going to want to make sure that you tell them to leave and make sure you keep doing it until they leave. So your brain keeps bringing to the front of your mind those thoughts that it thinks, yeah, this is a potential danger here. This is causing a lot of fear and chaos in your mind. So you want to pay attention to it. So if you respond to an intrusive thought with fear, right? If you have a fearful response to an intrusive thought, that causes your brain to pay more attention to the thought. But the problem there is that the more your brain pays attention to that thought, then it's going to create more fear, right? So you have fear because of an intrusive thought, paying more attention to it, which causes more fear. And just like that, we can find ourselves in a cycle of anxiety that comes from intrusive thoughts. And so, how do we deal with this in therapy? Well, one of the things that we try to keep in mind is that a thought is a thought, right? A thought is not necessarily you, it is not what you believe in, it is not a reflection of you. A thought is just a thought. So, we really try to re-emphasize the control and the power that you have over what you do with the thought. You can't necessarily control the thought entering your mind. That we know. But you can control what you do in response to that thought. And this is where the magic lies because the first thing we really want to do with that is to name the thought, right? And so you hear people now say it often, I'm getting an intrusive thought. That's good. Because by naming the thought as an intrusive thought, you're taking back some power for yourself, right? Because that's essentially saying, I know what this is. I know what you're up to here. and I know what I need to do with you, right? So you take some power back. And we want to really emphasize the importance of that sense of control. Again, not necessarily over the thought, but over how much you allow the thought to bother you, just like that party guest. Even if they insist that they want to stay, you have the power to then walk away and continue to enjoy your party and keep some distance between you, right? So we try to reestablish control. Essentially, what we can do is to change the relationship with the intrusive thought. Instead of one of fear, which causes more attention and causes the intrusive thought to grow, we take on maybe more of a perspective of curiosity and some empathy, right? To keep some distance between us and that thought, understanding that the thought is not a reflection of us. So really it's important to restore that sense of confidence. And there's hope that this can be done. It can seem very difficult and insurmountable. Anyone who is dealing with this, struggling with intrusive thoughts, that they've really been getting a lot of pressure from, just know that you're not alone. It happens, it's pretty normal. And in therapy, we help people to manage those intrusive thoughts, to reconnect with a sense of calmness and control.
Thank you for joining us today. I hope you found this informative. If you have some topics you'd like me to discuss, please put them in the comments below. Until next time, I'm your host, Dr. Elaine Malik.